Bridget, can I ask you to answer this one? Interested in how SMARS has placed the sustainable officer and the clinical leads. Do they work in their own SDU? And where does it sit in SMARS?
Well, that goes right to the heart of what we're grappling with at the moment. My position actually sits in the contract management division, which is a legacy of history, and whether it'll stay there or not, I don't know. But I do have amazing contract management is so important because that's our procurement arm, and so I sit amongst the contract management team, and they're fantastic. And for me, it hasn't really made a huge difference as to where I'm positioned in the organisation because I just work across the whole organisation. I just happen to come under the contract management directorate. Our nursing and medical leads, they're actually a Fiona Stanley Fremantle Hospital Group funded positions, so they work across those two sites. They're not SMARS wide at this point in time, but our next step is to look at how to embed those positions better across the entire health service and what that looks like. And I absolutely love the climate leads for specialties, and I think that's another route we have to go down. So I think where I sit is not important. I think it's the resourcing of people and giving people the time, especially our clinical people. If we want them to do this work, we can't expect them to do it after hours in amongst other things. We have to give them dedicated quarantine time to do this work, and that's how we're going to make progress.
Thank you, Bridget. Kim, can I throw a question to you? How do you involve consumers when you're thinking about bringing sustainability into business as usual? How do you use the voice of consumers either in the co-design or actually creating the need?
Yeah, so the question is, how do you invite them for the conversation? So, do you have the time when they're face to face? Do you ask a group of people to volunteer to help you co-design something? But you're going to have to do some sort of community engagement to actually go and do that. I know you've talked about the impact in maternity, and I know, for example, I'd be quite happy when my child was in the nursery to have gone and sterilized bottles and containers when I brought in breast milk, but that wasn't available to me. Often it was simply just thrown out without anyone actually asking me if I was prepared to go and sterilize and reuse some of those containers. So look, you're just going to have to design a community engagement program to actually do that. And yeah.
Thank you, Kim. Ricki, there's a question here about communication approaches and change management approaches when you're implementing change. Is there any tips, tricks that you would do? Any lessons you've learned? You're smiling there, so I'm sure there's something in the background that you'd like to share with us.
Yeah, absolutely. To bring staff together, you've got to make it fun and you've got to make it easy. And the tips and tricks would be keep it simple, stupid, the KISS method. That always works above and beyond with everything. And we just had to break it down into small bites. And if everybody can just do one tiny little thing every day and keep doing that same thing, it takes 9 months to change a habit, particularly with plastic. And it takes a long time. So just keep it simple, stupid, or keep it simple, Sally.
Beautiful, beautiful. Thank you, Luke. I'll ask you a question. It's interesting. Somebody sitting outside of healthcare, but how do you think we could make the case, like you've heard it embedded and weaved into the conversation, that we need more? We need more together. But sitting outside of healthcare and looking in, how do we make the case for more dollars?
Yeah, that's a really tough question to throw me, to be fair. I would have preferred the previous question, to be fair. Look, I think the case is starting to make itself. to be honest. I think we were talking just sort of in the break that really what we do need is more funding and more. We were just hearing from Russ earlier on today about the fact that this is what staff are prioritising. This is the number 2 priority. So as someone who sits outside of healthcare, what seems really odd to me is the lack of resourcing that sits within healthcare to do something about the challenge. So I think the trajectory is good. I do sort of pop in and out of healthcare, but not in sort of the sort of tertiary, but I'm mainly in sort of primary prevention space. But I think you advocate. I think you lead by example. I think you do all of the things that everybody here is doing. You harness the role of the champions internally, and you just keep banging the drum. I don't think there's really a hard and fast and simple answer. I think you just need to come at it from a lot of different angles, and really understand what it is from a behavioural standpoint. We're just looking at what makes people tick and what decisions are predicated on. And so it's understanding where people see value, where decision makers see value, and looking to leverage that.
Jen, question for you. If you had a crystal ball, that's a dangerous proposition. What would you like to see done in the next 12 months, maybe 5 years? Where would you like to see if we all came back together after this event?
So many things. That every health service has a sustainability officer, and oh my gosh, there's so many things. So let's start at the top. So yes, we have an SDU. It is not permanently in place in funding for WA Health. I'd like to see that first, and like to have that WA SDU have more influence, I guess, and be able to access data across WA Health so that we can make changes that way. Also, like to see a sustainability officer for every health service across each state in Australia, everywhere, and clinical leads, nursing, medical, allied health. We have to, and more engagement around supporting our GPs in the community. We don't want to have we have GPs in our community who can care for many of the patients that end up in hospital. That would phenomenally decarbonise a lot of our healthcare, and also there were a lot of wonderful things said by some wonderful politicians this morning, but I would like to see more activity. So fund the things they're talking about. It's not enough to talk about it. We need to fund departments more, better. And I could go on for hours, Tim.
We're just at time. I'd like to thank you for listening and engaging. And one thing I'd like to leave you with, and it goes about the funding and the momentum, is finding your tribe is important. This is a lonely space, and it's really hard, and you need a resilience. And sometimes I'm up, and sometimes Bridget's down or Jen's down, and it's a team sport. So Robin has just left early for another meeting, but Robin is one of our tribe. She gets it. She's a sponsor. So is Paul, our CE. Find your tribe is a really important component of this. We've got our tribe. It's not big enough just yet, but it will get bigger. And if you haven't got a tribe, please come and join ours. We're happy to share. We're happy to share. We're all doing the same thing, so let's make it easy on ourselves. Could you please put your hands together for a fantastic panel? And the people that haven't represented SMARS and the sustainability community up here today, thank you for all the great work you're doing. And I'm looking forward to seeing this again next year, bigger and better, and hearing the more money. Thank you.